here with the rest of the PBRN Coordinating Center. We're going to get started here in just another minute or so. Give folks a little more time to get logged in and queued up. Well, again, good afternoon, everybody, and welcome to the Public Health PBRN quarterly webinar, skill building webinar. Hope everybody's summer is going well, and you're navigating the competing priorities that always come up this time of year with professional and personal obligations. We're hopefully have a very useful session in store for you here today from one of our own, Anna Goodman Hoover, who's our Deputy Director of the PBRN program here with us at the coordinating here at University of Kentucky, is going to lead today's webinar on a topic that we know is of considerable interest for a number of our public health PBRNs. And that's the concept of developing community-based research projects in public health, and in particular the grantsmanship component of developing those proposals. Anna is really an excellent person to have queued up to offer this session for us. She, as many of you know, she really has joined our PBRN program only relatively recently. She started up back in April with us as the Deputy Director, but she actually has a very long track record in working in the world of applied public health research, particularly in the environmental health arena. For about 10 years now, Anna has worked with a couple of different research institutes based here at the University of Kentucky that design and conduct applied studies in public health, environmental health research, with the Water Research Institute here at UK, and also with the Superfund Research program here at the University of Kentucky. And it so happens that both of those institutes have been actively involved in doing community-based participatory research in the area of environmental public health. And that's also not surprising for those of you who've worked in this area, because the environmental health research arena was one of the earlier areas of research to really adopt and explore the use of community-based participatory research as part of their research activities, partly motivated by the need to address environmental justice issues and the critical role of community engagement in designing and conducting those kind of studies that can help us address those issues. So Anna's really been working in the midst of these issues for, again, as I said, for at least a decade now, based on her work with our environmental health research here at UK. She's also, as many of you know, finishing up her PhD in communication science, which that is a discipline in and of itself that has really pushed the envelope methodologically with how to approach these issues of community engagement, again, from a research and scientific perspective. And obviously, communication communication strategies are major forces at play in thinking about community engagement. So Anna agreed to host this webinar for us. And again, as I mentioned, as you'll notice in the title here, the emphasis really here is on developing grant proposals and thinking about how to position research from a grantsmanship, grant application perspective. Anna also has served on study sections and review committees for a number of the federal agencies that fund in this area, particularly NIEHS, the National Institute for Environmental Health Sciences, which is one of the NIH institutes, the institute that's really dedicated to public health and environmental health research. But she's also done worked on funded projects funded by the the Environmental Protection Agency, EPA, Department of Energy, and I know Anna a number of others that I'm leaving off. But so Anna really is a wonderful resource to talk about these issues, both the design of community-based research projects, but also from a grantsmanship perspective, what grant reviewers are looking at, what they consider, what they discuss in looking at these proposals. And so, again, I want to thank Anna for taking time to tee this up for us. And I will turn it over to you, Anna, if you're ready to move on.
I am. Thank you so much, Glenn, for that introduction. A couple of caveats before we get started. Number one is I'm very passionate about talking about this subject, and normally when I do it, it's in a room where I can look at you and you can look at me, and I can sort of get a feel for how we're progressing, if I need to give more detail or less detail. So by all means, since I don't have that option here in the webinar format, please use the chat box, type in questions as they come up. If I don't have a chance to get to them during the talk, we'll get to them at the end, and we'll also open the floor for some discussion at the end. The second caveat, I've been fighting a bit of a cough, so I may sound a little bit more like a baritone than an alto today, in which case I apologize if I'm speaking too fast or too deeply. Let me know, and I'll try to slow down. Sometimes I get so excited about what I'm talking about here that I can get a little bit carried away. As Glenn said, my background is primarily in environmental health communication. I've worked on a number of engagement projects in that area. I'll tell you something about them a little bit later in the presentation. I come to the PBRN after a long time of working with the Superfund Research Program Research Translation Corps here at UK, which is funded through National Institute of Environmental Health Sciences. And my degree is in participatory communication, which has a specific, well, my master's is in health communication, and my PhD that I'm working on is in participatory risk communication, which has a very distinct investment in engaged research like what we'll be talking about here today. So I thought I'd begin by giving a little roadmap of where we're going to go over the next 45 minutes, hour or so before we open up for discussion. We're going to talk a little bit about what CBPR is, what is community-based research. Very likely many of you already have a good idea of this. Most of you probably do, but I find it good to define terms at the outset so that we're all talking about the same thing. We'll then talk a little bit about the RFP, or the request for proposals or request for abstracts, whatever your particular funding agency calls it, or a call for proposals, and how to find the review criteria in that. We'll talk a little bit about the role of the reviewer, the idiosyncrasies of the reviewer, because we did not all come off of an assembly line, which is a dangerous thing when you get a bunch of people with opinions in a room sometime, and the review panel and how that functions. Then we'll talk a little bit about the proposal process and how taking those pieces we've already discussed, the request for proposals, the review criteria, the reviewer, and how the review panel functions, how we can take that knowledge and work it into our proposal process in a way that gives us maybe an advantage over folks who aren't taking all of those elements into consideration when they're writing their grant proposals. I'll talk a little bit about common mistakes in CBPR proposals, and as I'll get into later, different reviewers have different mistakes that really stand out to them, but there are a couple that are, from a CBPR reviewer standpoint, fairly recognizable, fairly egregious, and can really derail a proposal. So I want to make sure that we talk about those. And then we'll talk a bit about red flags, which are a little more idiosyncratic, a little more reviewer-based, but some of them do pop up among a number of reviewers. So we'll tell you some words you might want to avoid, or at least think strongly about when you're using them in your proposal. So what is community-based participatory research? NIH's Office of Behavior and Social Sciences Research has a very distinct definition. They call it an applied collaborative approach that enables community residents to more actively participate in the full spectrum of research. That means from conception, the design of the research question, the design of the approach, to the conduct of the research itself, through the analysis phase, into interpretation, drawing conclusions as a partnership, and communicating the results. So you're really involving your community in every step of the process. Now for PBRNs, we already have that sort of model in many ways because we have academics partnering with practitioners, generating research questions together, generating approaches together, and analyzing data together. So in many ways, PBRNs are very comparable to CBPR, and I think that there are probably a lot of opportunities for the networks to capitalize on this relationship through some careful crafting of grant proposals that perhaps looks at the PBRN as a community of practice, or even if you're working with specific practitioners in a particular community, you can posit that as a community partner for CBPR research. So there are a number of ways that the PBRNs already fit within this OBSSR definition. And the goal of CBPR is to influence change in community health, in systems, which is of particular concern to our PBRNs, programs and policies. So again, we're already doing, through our PBRNs, a lot of research in these areas, so I think it's important to identify where there might be a CBPR linkage and capitalize on that. According to OBSSR, community members and researchers partner to combine knowledge and action for social change to improve community health and often reduce health disparities. Academic research and community partners, again, this is the PBRN model in many ways, join to develop models and approaches to building communication, trust, and capacity with the final goal of increasing community participation in the research process. Trust is a little bit of a bugaboo sometimes. The traditional approach to research, as many of you know, has been an academic gets a grant, goes into a community, extracts data from the community, goes back, analyzes that data, publishes, and then it's pretty much forgotten. Decades of that kind of approach, of sort of extractive, or what some call almost colonialist approaches to research, has damaged trust between some academic entities and universities in certain communities, particularly disparities communities, which are often employed to get funding because disparities is such a major problem in our country, and they don't feel like they are properly invested in, have been historically properly invested in the process. So conducting CBPR is not something that you're going to walk into a community and say, hey, I want to partner with you, and suddenly there's going to be sunshine and roses. There's going to have to be a trust-building process, and that's why so many participatory grants include planning grants. They begin by giving funding to help develop those relationships, to help develop that trust, so that you really can move together in a productive way. OBSSR also says that CBPR is an orientation to research which equitably involves all partners in the research process and recognizes the unique strengths that each brings. And it is regarded as an effective method for transferring evidence-based research to communities that can most benefit, thereby improving health. So again, that translational potential that the PBRNs are so concerned with. This is something that is just inherent in the CBPR enterprise. So that said, what are some of the goals of community-based research? Well, engagement, true partnership. The community brings expertise about the community. They have knowledge of the values. They have knowledge of the decision-making processes. They have knowledge of potential pitfalls that are community-specific. They bring that to the table. The academics bring scientific knowledge or other kinds of academic information into the partnership, and they're able to bring resources together in an engaged way. So it really empowers the communities to become part of this process. It empowers them to become engaged in decision-making. It empowers them to become engaged in determining, well, what does this piece of data actually say about my community? It promotes collaborative decision-making, which of course can lead to other endeavors beyond the research enterprise down the line that can really build capacity for that community. There is a focus on community values, culture, and perspectives about the future. CBPR is not a process by which you are going to conduct a CBPR project in Community A, and it is automatically going to transfer effectively and efficiently to Community B. But what you learn from Community A will give you the tools and the processes, perhaps, to help find an equally culturally appropriate solution in Community B. So it's very important that you take into consideration when you're conducting research, not just CBPR research, in my opinion, but any research. What are the values of the communities in which you're working? But it is especially important for CBPR research. You also want to build trust among all the parties. I've already talked about this. This is so key to try to undo decades of distrust that has built up through extractive research processes. I know that I have worked with some communities in Appalachia where researchers have come in over the years, said, we really care about your community, we're doing this research on your community, help us identify these things, and then they never even heard how the study came out. They never heard what the results of the study were. So when you come into town and you have your university hat on, there's an automatic sort of distrust of, yeah, sure you care about our community, you've got some grant funding, and as soon as the grant money runs out, you're going to be gone too. So it's very important to understand where they're coming from and to really work to build strong partnerships, strong relationships, so that you can move important research projects forward together. So just very briefly, this is the academic side of me having to throw in a few key historical points. At the end, I do have some resources that you can use if you're interested in looking up any of this, but community-based research has sort of arisen over the years from recognition that those extractive practices have not been productive. They have not necessarily led to the most valid conclusions based on data sets, because those conclusions were rooted in external knowledge instead of in edict knowledge, instead of emic knowledge, and the knowledge of the outsider instead of someone who actually lives and works in that community, understanding what it means for the people who live there. So the idea of action research was formulated in the 1940s by Carl Levin. It's a sort of an iterative process of analysis and reflection between the researcher and the then subject. Over time, CBPR really sort of developed out of the development work going on in the developing world. So people from the West would go in, give out questionnaires about new innovations. I mean, we all know diffusion of innovations, I'm sure. New innovations, do these questionnaires, take them back, analyze them, and they had their answers. But it became more and more apparent that the questions weren't even relevant in some cases, the questions on the questionnaires, because no one had asked the community members what, in fact, was relevant about this innovation for their community. So rapid rural appraisal in the 70s was sort of an attempt to move away from that practice, to let go of the questionnaire-based research, to ask questions, ask open-ended questions of the community, work with them to identify what really the issues were. But again, at the end of that process, researchers took the data that they had collected, took it back to their homes in London or New York or wherever they were, and analyzed it independent of input from the communities themselves. So in the 80s and 90s, there was really a shift toward including community members in every aspect of the research. And you can see here some of those approaches, PRA, PLA, PRCA, and of course CBPR, and those have sort of evolved over the years. My particular area is community-based participatory communication, which rose through the United Nations Food and Agriculture Organization. I've done a lot of work based in that paradigm, so it's a very community-based social scientific approach. Now that we know that over the last, say, 40, 50 years, there has been a move towards CBPR, we can also comment that APHA has been a real leader in furthering that. As early as 2004, they issued a statement urging the following, and I know you can read these, but I like reading them because they make me happy. They have urged public and private support for community-based participatory research, including the planning grants I was talking about, and resources for documentation and evaluation of community participation. And I think that those of us working in the area realize that those things had happened largely. They also urged public and private support for training in community-based participatory research, which has also been happening. I've been privileged to be part of some of that. A fair distribution of research resources, including monetary, among academic and community partners involved. Now, this is an area that is perhaps a bit more contentious than others. It's one that has made progress, but is not necessarily all the way there, because what frequently happens is that the academic partner in a CBPR project has the infrastructure, has the resources, has that Office of Sponsored Projects or its equivalent to manage those grant funds. So sometimes it is a little difficult to strike that resources balance. But there are more and better ways coming along, whether they're subcontracts. There are a variety of ways to make sure that those resources get distributed more equitably. And I think it's very important when you're writing your community-based participatory research proposals to think about that. Think about when a reviewer looks at that proposal, do they see equitable distribution of resources? Or do they see a monolithic university taking control of the whole process? So that's just something to keep in mind. APHA had also urged policymakers to engage community-based in community research partnerships in the process of policymaking. And obviously that is something that is also of key concern to the PBRNs. We want our research to inform policy, to help promote evidence-based decisions. So there is another overlap there with PBRN work and CBPR. And I would just say that in supporting this APHA, AJPH has been a really terrific resource for furthering the dialogue about community-based participatory research. There have been a number of articles. I'm looking right now from August of last year. There was an editorial on his CBPR loss in translational research. There's also a citation at the end of this presentation on an article by Wallerstein and Duran from a couple of years ago, around 2010, in which she had a conceptual logic model of community-based participatory research. I keep it right on my desk all the time. It's very handy. And really, Wallerstein, Duran, those guys are where you want to start when you're just getting introduced to the participatory literature. All right, moving to the next slide. Now, I can talk about CBPR grants all day long, but it's not going to be very helpful unless we have something really concrete to look at, to talk about, to think about. So I'd like us to look briefly at this National Institute on Minority Health Disparities. That's one of the NIH institutes, as most of you know. They have a community-based participatory research initiative in reducing and eliminating health disparities. And this particular funding mechanism is for the planning phase. So this is for that trust building phase. So I think it's really beneficial for some of you who are maybe thinking about writing your first CBPR grant to look at. Now this is going to be a little tricky because I need to change something over on my computer, and hopefully we can make this work. 1 second, and there it is. This is the RFA for that grant that I just mentioned. You can see that it is fairly complicated. A lot of you have probably previously done NIH grants. If you have not, the way they are laid out is not always the most user-friendly. If you're just looking at the layout of the proposal guidelines. Furthermore, they also have this little trick that they like to work in at the beginning about consulting the PHS 398. Let me see if I can find it here. The PHS 398 application guide. Specifically, it says, it is critical that applicants follow the instructions in the PHS 398 application guide, except for instructed to do otherwise. And for those of you who have not seen that lovely piece of literature, it's about 120 pages long. So in addition to this long scrolling down document that I'm probably making people dizzy with, you have this 121-page guidance for exactly how things need to be laid out. So first and foremost, when you're thinking about doing a grant proposal, you need to read every part of this RFA. Whatever proposal you're thinking about doing, you need to read every part of the RFA, CFP, whatever your funding agency calls it, no matter how long it is. And this is true for all grant proposals, not just for CBPR. You need to familiarize yourself with what they are looking for. If you are eligible, there are so many issues within this that you really need to address before you put pen to paper, before you call that first planning meeting. Make sure that you know this RFA inside and outside. So, for example, in this PHS 398 application guide piece, it says very distinctly, applications that do not comply with these instructions may be delayed or not accepted for review. So you don't want to put hours and hours into planning meetings, into writing, and then have your proposal kicked out because you didn't have something formatted correctly. And if you get it in early enough, your program officer might be nice and kick it back to you and say, you really need to look at how this is formatted. If you're someone who, as often happens, gets it in to your OSPA 5 minutes before the deadline, you may not get it kicked back to you at all. You'll be past the deadline and you won't be able to get it in. So make sure that you're following the instructions. As a reviewer, the first thing that I would do with this is look at it and make notes about the key pieces. So, for example, in the instructions here, they lay out the goal of the funding very explicitly. The goal is to support partnerships between health disparities communities and researchers to engage in community-based participatory research to plan and implement interventions to reduce health disparities. So that, I know that's what I'm looking for. I'm looking for projects that do exactly that. That, one, support partnerships, true partnerships between disparities communities and researchers, and that, two, are trying to introduce some interventions to reduce health disparities. So anything that is submitted, no matter how brilliant, that doesn't do one of those two things, as a reviewer, I flag that as not really meeting the criteria of the proposal. So we want to make sure when you're doing your proposal that that is first and foremost. That goal is evident in every piece of your proposal. I also would look at the appropriate topic areas. Those are also laid out right here. They're looking at intervention-based research, specifically to promote healthy lifestyle behaviors, to promote disease management, to focus on the cessation or prevention of tobacco use, or promoting healthy sexual behaviors, preventing or reducing intentional or unintentional accidents, and promoting preventive behaviors. So again, as I am looking through, those I'm going to flag, anything that falls under those parameters I'm going to flag as, oh, these definitely fill the criteria. Now, appropriate topics include but are not limited to those. So as a reviewer, I have some purview to say, okay, this isn't specifically one of those, but does it actually meet the call, the overall goal of the research, and the overall goal of the RFA? And if that is the case, then I'm probably going to say, well, that's okay. But that is where you start getting into the subjectivity of the reviewer, because what I think may be an appropriate topic area may or may not be a matter of agreement with some of the other reviewers, and that could lead to a discussion during the review itself. So I just want to point out that you want to make explicit how you are meeting that goal as defined by the request for proposals. Also, one other thing, and this is so important, first thing, check your eligibility. In CBPR, it's a much wider field than a lot of things, but whatever proposal you're writing, check your eligibility. You don't want to have spent hours and days working on a grant proposal and find out you're an ineligible organization. In this case, you know, you have everything from higher education institutions to nonprofits to for-profits to governments. So you have a lot of leeway. But when you're doing any grant proposal, check that eligibility. And if you're not sure if you're eligible, contact the program officer identified in the call for proposals, because you really want to make sure that you're in good stead before you move too far down the line. Now, I'm going to try to flip back to the presentation. We'll see how this works. There it is, one thing at a time. All right, so now you've as a reviewer, you have read the RFA, and then when you start reading proposals as a reviewer, you are given specific guidelines by which to evaluate the merit of the proposals. Now, I'm going to talk specifically about NIH's guidelines, which are very clearly delineated, but those are the criteria used in almost any grant. It's just typically called something different. So I will share with you this cartoon that I like. We often say people write to the proposal or they research to the funding, and this is an example of that. If this evidence is correct, it'll rock the very foundations of our research grant application. It's funny, but it's also true. When you're doing your research, think about how it's going to fit into, but don't let the research drive. I don't let the funding drive the application, because remember, with community-based research, you're supposed to be addressing questions that are very specific to the community you're working with. And so if you're developing that in a lab to write it to a funding mechanism, then you may not be addressing the most relevant questions. At NIH, there are 5 criteria that you are primarily reviewing on: significance, investigators, innovation, approach, and environment. And I hope you'll excuse reading for a moment because I want to read to you the exact specifications that NIH gives you for meeting those criteria. They define significance as, does the project address an important problem or critical barrier to progress in the field? If the aims of the project are achieved, how will scientific knowledge, technical capability, and/or clinical practice be improved? How will successful completion of the aims change the concepts, methods, technologies, treatments, services, or preventive interventions that drive this field? In other words, your lit review. This is where you want to establish what the state of the field is, where it has come from, where it is today, and why your research project is so important to furthering the field. This is true whether you're doing a community-based participatory research proposal, whether you're doing a bench proposal, whether you're doing a questionnaire, whether you're doing survey-based research, whatever it is, you want to establish what is the state of the field, where is it going, and how is my work going to help it get there. With community-based participatory research, you have a little bit extra burden in that you need to define also where your proposal fits within the state of community-based participatory research. That means you need to familiarize yourself a little bit with that literature. You need to make sure that it is clear that you understand the literature, that you understand what is and is not community-based participatory research, and that you are situating your project within that body, within that particular approach. So that's where significance is. Think lit review, think really punching up why you're important to the field. Investigators. NIH says of investigators are the PDs, PIs, collaborators, and other researchers well suited to the project. If early stage investigators or new investigators are in the early stages of independent careers, do they have appropriate experience and training? If established, have they demonstrated an ongoing record of accomplishment? That is how investigators are reviewed on virtually all NIH grants. However, if there is a CBPR component to your grant, you need to make sure that your investigators reflect not only the scientific knowledge, but also the community-based knowledge. You want to make sure that at least one of your investigators is a representative of the community, not necessarily a scientist, not necessarily someone with an academic background, but someone who is embedded in that community, someone who has the connections to make sure that the community is fully engaged in that research. So your investigators need to reflect your basic partnership that is at the core of your engaged research. Innovation. Does the application challenge and seek to shift current research or clinical practice paradigms by utilizing novel theoretical concepts, approaches or methodologies, instrumentation, or interventions? So are you really pushing the envelope? Are you doing something that's going to change the way that science is done? And this is interesting because sometimes that piece and the significance piece don't always fit together as well, because the innovation is your high risk, high reward, but the significance is why it's important. So when you're doing high risk, high reward, if it is not successful, if it is innovative but is not successful, then the significance obviously takes a hit. And the way that is, the way that conversation plays out in review committees is very interesting, and very often it depends on who the loudest reviewer is in the room, to be quite honest. We'll talk a little bit about the review meeting and how that all works in just a moment, but just remember that it may not be possible for you to, the Olympics are going on, so it may not be possible for you to score perfect 10s on every one of these criteria. That's not a bad thing. Some of them balance each other out. The important thing is that you show that your research is important, that it's relevant, that it's engaged. All right, approach. This is your methodology section. Is the strategy suited to the research you're hoping to do? In the case of CBPR proposals, you want to make sure that approach includes how you're engaging your community partners, or if you're a community partner, how you're engaging your academic partners at every step of the process. So you want to talk through how you work together to identify preliminary research questions, how you're going to work together to analyze data, how you're going to work together to disseminate the findings. So you really want to make sure that, you have, again, with CBPR, you have a little extra burden, because in addition to all of the normal work you would put into putting together a really strong proposal, you're always having to reinforce that you do have that partnership, that community partnership is in place, it is active, it is vibrant, and this is how we're doing it, because you cannot assume that saying, yeah, we'll stay engaged with our community partners is going to mean anything to a reviewer. We will speak with our community partners via WebEx twice a month. That's a little more firm. We will have weekly telephone calls, even better. You want to make sure that your approach includes the approach to the partnership. An environment. Those of us on the academic side are used to writing pieces about the environment that are, our university has X number of computers and this amazing microarray and all of these pieces. But you also want to talk about the community environment. Our community partner is engaged and embedded in our community in these ways and has this many contacts, and these groups have already shown some excitement and enthusiasm about being a part of this project, and we already have commitments from these groups to participate. So the environment goes beyond the academic halls in a CBPR proposal. You want to make sure you're including your community partners. The individual reviewer, and those of you who have been on review committees know why I picked this picture. It's very, very important to remember that your reviewer is going to see, dozens at the very least, probably hundreds of pages. They could have anywhere from 3 to 10 reviews that they are responsible for. You want yours to stand out, and you want it to stand out in a really good way. I'm getting ready to do a review committee in about a month, and I am assigned seven proposals, and that's 1,000 pages of reading. So it's easy to get lost in those 1,000 pages if your proposal is not strong. It's also easy to be the one that stands out for being a misfire. So you want to take every step possible to make sure that yours stands out, but it stands out in a good way. The thing I really want to get across about individual reviewers is that it's the word individual more than the word reviewer. Yes, we are given guidelines for how to review a proposal. I just talked you through those: significance, approach, investigator, innovation, environment. Sometimes we have conference calls with the program officer who tells us exactly what the criteria are for things that seem minuscule. But at the same time, no one checks his or her personality at the door. Reviewers are in that room because they're passionate about the work. They're passionate about that area of study. And particularly with people engaged in community-based participatory research, they're passionate about that approach. And there are reasons for that, and you don't leave those at the door. So in my case, I'm originally from rural Appalachia. I'm from a community where extractive resource removal was practiced, and the community did not have a whole lot to say in its future. And now that community is, like many in Appalachia, withering on the vine. So I come from a place personally that is very much about making sure that communities are participating in diagnosing their own problems and finding solutions. Other people in that room come from other backgrounds and may have slightly different approaches, but many of them share those kinds of values, that the community really should be part and parcel of solving its own challenges. So know that when you're putting your proposal together. Know that that community involvement is key for so many of the CBPR reviewers. And I also mention that because I'm giving this presentation, and it's always good to remember that the person who's presenting in any presentation has a particular perspective. So I wasn't born in the president's office across campus. I come to this position with my own biases. I try to acknowledge them, and I try not to let them influence things unduly, but at the same time, they're part of who I am, and they're part of the decisions I make, and some of those decisions involve grant reviews, and that's true of every person in that room. So one other thing I wanted to mention was I did have the opportunity to pilot as a graduate student. The University of Kentucky had the contract with NIH to develop online grant proposal training for traditionally minority universities. So I had an opportunity to help beta test that group. So I have a little inside knowledge to that process, to the training people to write grant proposal processes. So that's something I also bring to this conversation. And I didn't want to let Dawn Frazier's contribution to my knowledge of what goes on at NIH and grantsmanship go unmentioned. But again, all of these life experiences situate me in a particular place and make me very passionate about engagement and participation. And while I try my best to review based on the criteria, and I know everyone in that room tries based on the criteria, if something sort of rubs you the wrong way, makes you think that perhaps this is not really a community-based grant, perhaps this is something else that is masquerading as a community-based grant, that can be a really quick way to shoot down your own proposal. So I'm going to get into some ways to avoid that in just a moment. But we're going to talk now about how you can make sure that your proposals appeal to different reviewers with different kinds of backgrounds. But to do that, we need to talk a little bit about the review panel itself and how that works. So as I mentioned, you have a review panel. I've been on review panels anywhere from 5 people in a teeny tiny meeting room in a hotel to upwards of 60 in a giant ballroom of a hotel. And it just depends on the funding agency, the complexity of the grant, if it's a multi-project program grant, a number of things. But you can have 5 to 50, 60 people in a room that you're trying to convince that your project is worthwhile. So the way you do that is by recruiting reviewers to your side. And the way you do that is through really strong science and really strong partnerships, exhibiting that within your proposal. And here's why it's important. Because at a review meeting, every reviewer is assigned to specific proposals. You might be a primary reviewer, a secondary reviewer, a tertiary reviewer, or a member of the committee. If you're a primary reviewer, you are going to read that proposal, know it inside out, make lots and lots of notes, because when they get to that proposal, you're going to be in charge of reminding everyone in the room what the proposal was. In an ideal world, everyone sitting at that review table will have read, at least skimmed that proposal. It is not an ideal world. Sometimes time constraints get in the way and not everyone in the room has read the proposal. So the primary, secondary, and tertiary reviewers wield a great deal of influence in those final scores. So for a CBPR grant, a social scientist like myself might be a primary or secondary reviewer. So it's very important to think about that as you're crafting your work. Now, what happens in the review committee is the chair of the panel will say, okay, primary review committee member, secondary, tertiary, give me your preliminary scores. And you will have established within your mind and on a piece of paper what you think the value of that particular proposal is. In an NIH grant, those scores range from 1, which is the best of the best, to 9, which is probably not going to get discussed by the review committee and just be tossed. It's called streamlining. So if you're looking at a 1 or a 2, then they'll go on to the second reviewer, who will then say, well, I give it a 4, and the third reviewer might give it a 6. After a discussion, a period of discussion in which they sort of debate what they found valuable, what they found to be weaknesses, what the primary reviewers just discuss the grant in great detail, the grant proposal in great detail, and debate its merits and its deficiencies. And then they are provided an opportunity, those primary reviewers are provided an opportunity to change their scores. And in changing their scores, the remainder of the review committee must enter scores in for that proposal within the range of scores. So if the primary reviewer gives it a 2 and the secondary reviewer gives it a 6, all scores must be between a 2 and a 6. The fact of the matter is that after the discussion, it's usually a much smaller range. I can talk about this all day, and it may not make any sense if you've not been in that review committee room. However, NIH has very kindly put online an example of the process. So what I'm going to do is just show you a very brief video. It should only take a moment. Show you about 4 minutes of this so that you can see what it looks like in progress.
All right, so we'll start with the first application, and just a reminder, this is from a new investigator, so our special considerations for NIH for new investigators apply here. This is from Dr. Fred Nicaros from Stanford University, defining nickel accumulation in Cronstedt's disease. The reviewers are David Granger, Brian Huffman, and Martin Filbert, and we'll start by just going around to the three of you and getting your preliminary impact scores.
I was less than enthusiastic with a score of 5. 5? Okay, great. Brian?
I was very enthusiastic and came out with a score of 2.
Martin Filbert? 2. 2. 5, 2, 2. David, let's give us a quick summary of the substance of the proposal and then your review comments.
Yeah, this proposal uses high-density micro and nano-electrode arrays from a talented analytical chemist to determine the distribution of nickel. On this particular application, I was assigned to be the primary reviewer. That reviewer's job is generally to introduce the application to the group, to provide a brief synopsis of the high points and some low points, to underscore the impact of the application, and then to proceed through the criteria for review which have been stipulated by the reviewing process. The weaknesses, though, in innovation are that the electrode array methods have been applied to tissues by other groups with success, and there are limitations that are recognized in the methodology, and the experience of the other groups and their limitations is not documented by the PI. In terms of the environment, the strengths of the environment is that it's very well suited. The PI is well instrumented, and the resources and the environment and its collaborations are in fact very appropriate. The weaknesses of the environment is that the available equipment for preparing samples and running perk hole gradients particularly is not evident. Access to fluorescence microscopy is detailed but not adequately described. I found that the overall impact strength was in defining then the intercellular distribution of the accumulated nickel in conditions of nickel overload and in the direct approach to the successful elucidation of these towards a new therapy. So overall, a balanced enthusiasm with the new investigator I found very nice for this particular PI, but I found numerous technical concerns.
Thanks, David. So, Brian, if we can move to any of your views that are complementary or contrasting.
I think I probably underweighted some of the flaws, didn't pick up on them or didn't weight them properly because I was so really enamored with these strengths. And I appreciate his reservations, but I come from a different direction because I was so taken with the methodology.
After my review, then the secondary reviewer, Dr. Hoffman, tempered some of the negative points that I had brought up and proposed an alternative view and proposed some other strengths which I didn't see in the initial read and the initial review.
Dr. Hoffman raised the points about the broad significance of this work that I think really began to turn the minds of the committee.
I agree with Brian's assessment. This is a highly innovative proposal from a junior investigator. It uses novel technologies that I think are going to provide great answers. Moreover, I think the innovation is heightened by the fact that virtually nothing is known about Cronstedt's disease.
Great, thank you. So let's move into a general discussion, and here we're really looking for your comments on aspects of the application that you think will really drive our consideration of the score. So, Gail?
Yeah, I had a question just because it is a new investigator, it's a complex system, and a as yet relatively uncharacterized disease. What do you think the new investigator's skills in terms of troubleshooting or at least having access to collaborators that may help in that respect?
You're right, it is a new investigator, but nonetheless, in this application, he surrounded himself with general competence to, I think, allay my problems with any confidence in his ability to go to his collaborative team and to adjust his bandwidth within his expertise and go to his collaborators where it's appropriate.
What he hasn't brought to the table in his electrochemistry, I think he'll gain and gather from his collaborators, and so it makes a good team and a good match.
And other comments, maybe I can go back to the first reviewers and see how you now consider your scores in view of the comments around the table and the nature of the discussion. David?
So I think I'm a bit too harsh with my 5, and I would be willing to reduce my score and increase my enthusiasm based on what I've heard from my collaborators and my friends here at the table. I guess I'll go to a 3.
Okay, so thank you. And Brian?
I'm no less enthusiastic about the methodology, but the framework in which it's embedded, the experimental framework that David's pointed out, weaknesses of, I have to come up a little bit, and I'll meet him at 3.
Thanks, Brian. So 2 3s, and Martin?
Yeah, I'm really sold on the innovation here and on the promise. So I'm going to stay at 2, especially since our comments are going to be communicated to this investigator.
Okay, so thank you. So strong enthusiasm for a new investigator, some reservations about the methodology and how well it will apply to the disease model. So a 2, a 3, and a 3. Terrific. Okay, so let's record our final scores.
Now, the important thing to realize from that video that we just watched is that one strong advocate on a committee can really help sway the discussion. So instead of the final scores on that proposal ranging from 2 to 5, and potentially half of the room voting it at a 5, suddenly you have a much narrower range. You have a 3-4 range, and folks are able to better quantify, folks who maybe have less experience with that particular proposal are able to better quantify where their scores should fall. So it's really important as a proposal writer that you find ways to recruit people on that committee to be your advocates when that discussion takes place. So how do you do that? You do it by making sure that your proposal is plugged in. You make sure that you are plugged into the science, your lit review is sound, your significance is clear, your approach is clean and understandable. You make sure you're plugged into the community. You make sure that the evidence of the partnership is throughout the proposal. You make sure that you have very clearly delineated how the two partners are working together, or more partners if you have multiple agencies involved. And you make sure that you're plugged into your available resources. And I'll just share one story about that. I was on a review once where a risk communication grant proposal had been submitted, and the university that had submitted this CVPR-based risk communication proposal did not recognize in the proposal that they had one of the top probably 10 risk communicators in the world at their university. That made me wonder how engaged they were on their own campus. Now, technically, you're supposed to come to a review committee focused on the criteria provided and not bring any outside knowledge into that. But if you know something like that, if you know that there is an available resource at that university or in that organization that is not being tapped, it is hard to completely set that aside. It raises a red flag that causes you to review the entire proposal a little more critically, perhaps, because if they're not breaking down silos on their campus, you have to wonder how they're breaking down silos between the campus and the community. So those are very important things to make sure that you have covered all your bases, so to speak, when you put your proposal together. Another way to recruit advocates to your side in that review is to determine if your path is clear. This is a slide that is normally used when you're teaching people how to put together PowerPoints, and it's used as an example of a slide that is way too busy for someone to understand. But I have read research grant proposals that are similarly complex, and you want your path to be clear. You want people to understand the methods and the approach that you're going to take, but at the same time, you don't want to give so much detail that they get lost and it doesn't leave you room to establish the significance or the innovation, because most grant proposals do have page limitations, and if you're down in the weeds the whole time, you're not able to make your big picture argument. So make your path clear, make it concise. And that's true not just for CVPR, but for pretty much any grant proposal you're writing. For CVPR particularly, do you exhibit teamwork? And again, it's Olympics time. I'm an Olympics fiend, so you're going to hear a lot about that here. The rowing was yesterday, and everyone was working smoothly together. That's what you want to see. You want to see that there are sections of the grant proposal where clearly the community partners have had a lot of input. There are sections of the grant proposal where perhaps the academic side has driven more of it, but it's a tandem. They're both right there, and it's very clear that they're working in collaboration with each other. Just like in elementary school, you were told to show your work by your math teacher, show your teamwork to your grant reviewers. It will really help you. Make sure that you've defined the roles and responsibilities of everyone involved in the project. Make sure that you've defined very clearly the built-in mechanisms for optimal interaction among the partners, and briefly discuss the process by which you're going to make decisions, including in many funders require you to stipulate what you will do if you come to an impasse. Will you seek outside arbitration if the partners can't agree on an approach? You know, there are different approaches to solving problems, to solving conflict, but they want to see that you've thought about what if conflict arises between the academic and the community partner. They want to see that these things have been thought through by both partners and that an amicable agreement has been met about how to resolve issues. So really, I mean, in terms of rowing, is every piece of this proposal pulling in the same direction? Now, I want to talk to you really quickly about the two participatory proposal errors that we probably see most often when doing CBPR reviews. And I've talked to some of my fellow reviewers, and we're all pretty much in agreement that these are both big errors that crop up a lot. The first is where you have a project that is very clearly participatory. The partnership, the community academic partnership is strong. The research question has been defined with the input of the community. They're going to analyze it together. It's a truly, truly participatory project. But the proposal is not embedded in the literature of engagement or participation. So it's like you have this beautiful house on the inside, but it hasn't been painted in 6, 10, 15, 20 years. So nobody knows. So the people who do participatory research, the social scientists on the committee might be able to look at that and say, well, they don't cite Wallerstein, they don't cite Duran, but the process is right. And if the process is right, then, just one second, we've got a little bit of a technical problem. We'll try to fix that. If the process is right, then we can sort of make the argument. Well, we think it's mostly there. They might want to think a little more about the literature. But sometimes it is hard for the social scientists among us to make that argument to bench scientists. If it's a project that some of us are social scientists, some of us are bench scientists, and we're trying to say, well, maybe it's not embedded in the literature, but in fact it's participatory, the bench scientists may say, well, I don't know enough about the field to know if it's embedded in the literature. I want to see, if it's truly participatory, I want to see some of the literature. So this is a very easy fix. Just familiarize yourself with, and I've put some resources in the end again, and I hope that you'll look at them, not just for the resources themselves, but for the, actual, I'm sorry, I'm having some technical difficulties on this end, but for their bibliographies and reference lists. That's what you want to do, is mine those to get a feel for the field. Lizette, I'm going to ask you, please, to take over the passing the slide to slide, if you can take that from your computer, because my computer appears to have locked up. And if you can you move us on to, thank you, can you move us on to the second participatory proposal error and let me know when you're there, because I think I'm going to have to reboot my presentation.
Okay, it's on participatory proposal error number 2.
Okay, thank you. Participatory error number 2 for a reviewer is more of a problem than participatory error number 1. It is something that is really a challenge for us who are embedded in the field.
Sorry for interruption, but it hasn't changed, the slide hasn't changed from the viewer's side. So I still see the error number 1.
Is that Gulzar?
This is Gulzar, yes.
Hi, Gulzar. Well, let me try rebooting from my end and seeing. I apologize.
No, it did change. There must be a slight delay, so I got it.
Okay. Let me just try rebooting from my end really quickly and seeing if I can pull this up. I'm sorry for the error. This is participatory.
Actually, it did change, so now I see the right slide.
All right. Well, this I'm going to call participatory error number 3 when WebEx lets you down. But thanks for letting me know. So I'm going to jump back into participatory error number 2, and I may not be able to see the slides with you, but hopefully I'll hop right in there any time now. Are you there?
Yes.
Okay. So in participatory error number 2, the jargon is there. They've looked at the RFA. They've used languages like engaged, and they've cited Duran and Wallerstein and Israel and Freire and everyone they should cite. But when it comes down to it, you look at the methodology within the proposal, and it's not. It's an unsound methodology. It's a top-down traditional research methodology in which the academics have all the power and the community members are sort of envisioned as passive recipients or maybe as tools to help with outreach. As a reviewer, and I've spoken to several other reviewers who specialize in community-based participatory research, and we sort of all feel the same. This is an egregious error, and it is very upsetting, And these are the kinds of proposals that will generate the most heated discussion in a review committee, because very often the scientific piece, the bench research or the survey-based research or whatever it may be is very strong, but it is not. And those of us who specialize in engaged research and participatory research will go to the mat over these kinds of proposals. I've done it myself. I know others who have, to say this may be a fine research proposal for another mechanism, but this is not community-based participatory research. You do not want this to happen. You do not want to look at the resources, to look at some of the publications that I've put at the end of this proposal, slap them on a standard proposal and call that CBPR, because that will, not only will that cause you problems for this review, but if that reviewer, that CBPR reviewer, ends up on another review that you're part of, they'll remember that. They'll remember what seemed to be trying to slide in regular research under CBPR, because that's where the funding was, and it will not fit well. So that said, your goal is to create a project that is truly participatory on the inside and has all of the fixings on the outside, that is clearly embedded in the literature. You know what CBPR is, you know what you're doing, and you're implementing it in practice. So make that clear in your proposals. Now, this is where I'm going to get back just very briefly to the idiosyncrasies of the researcher that I talked about. Again, my specialty is in communication, so my red flags may not be the same as other people's. I know some of these other reviewers have issues with as well, but some of them maybe not. So here are some words that I do not like to see in a CBPR proposal. Outreach. Outreach, and these are not, for me, these are not semantic. For me, these are embedded in the philosophy of the proposal. So if you say outreach, what you are telling me is that you have created a situation in which you are going to generate knowledge, an academic is going to generate knowledge, and then bestow that knowledge upon the community partner, as opposed to engaging the community partner in identifying and solving research problems. So outreach is a flag that makes me read that proposal much more carefully and look for errors in the way that the entire project is conceptualized. Now, there may not be those kinds of errors, and if that doesn't happen, then I'm happy, but that is a red flag that automatically causes me to read even more closely. The same with feedback. I know a lot of people love the word feedback. Feedback implies that you have put something out there for someone to respond to, which implies that the researcher, the academic side of the enterprise, has put something forth, and they're allowing the community to respond to it and may or may not take action on that. I would much rather see something along the lines of dialogue, where the community, the academic, they're bringing something to the table, each of them, they're working together in a dialogue to generate something new together. Same with bidirectional. Bidirectional is really popular. It's very vogue right now. I know a lot of funders love it. As a communications person, it's just one step better than feedback for me. I like dialogic. And again, that's one that is my idiosyncrasy. I know a couple of people who have a similar issue with it. That's probably of these the least egregious to most CBPR reviewers, but that's just one of my pet peeves. And teaching, if you're teaching, that's the same as outreach. You want to talk about co-learning. You want to talk about the community learning about the science, about you as a scientist learning about the community values, about learning from each other and learning with each other. So that said, those are my red flags. They're red flags for others. Lizette, I'm locking up again. Can you move on to the next slide, please, and let me know when we're there?
Well, you're there.
Okay, thank you. So finally, is your proposal ready for prime time? There are really three key issues here. The first, I've hammered away at from the beginning of the talk, and that is address all of your RFP requirements. Read it closely, make sure that everything it asks for is in there, and that is very, very key to a successful proposal. You'd be surprised at how many proposals go through and they leave major issues that are requested in the RFP out of the proposal entirely. Recruiting outside readers, because you want people who are unfamiliar with the project to know that so that you can have some sort of knowledge that your proposal flows well, that it's clear, that people from other disciplines can understand it, and that if there are potential questions popping up over and over and over again from your outside readers, then those are probably the questions that are going to pop up in review, so you want to make sure to go back to your narrative and address those. So it's very important to have outside folks who are unfamiliar with your project just put an eye to the proposal to make sure that it's okay. And then proofread. Please proofread. Think of your committee as your project's first external stakeholders. And if you can't communicate effectively to us what you want to do, how can we trust you to disseminate what you have done effectively? We need to know that you are an effective communicator so that when you have research results, you can share those with other people in a way that is meaningful to them. And if there are grammatical errors or things have been cut and pasted within the proposal that haven't been cleaned up, that's just a sign that you weren't paying attention. And if we're your first stakeholders and you can't pay attention for us, whom you're trying to get funding from, it's really hard to trust the back end of the process. So Lizette, if you would like to go to the next slide, please.
Okay.
So to sum up, I would ask you to consult your RFP, to make your case, to plug into your field, be clear and concise, affirm your partnership, and double, triple, and quadruple check everything. Now, most of those are true for any grant proposal. That affirm your partnership is true for your CBPR grant proposals particularly. It is essential that you understand that reviewers don't wake up in the morning and say, let me go see who I cannot fund today. When you start the review process, your first thought is, I'm going to see some great science. I'm really excited to be able to help wonderful, engaged science move forward, to play even the smallest part in that as a reviewer. And it's very disheartening if someone doesn't give you a chance to do that because they've put together a sloppy proposal, they don't understand necessarily what CBPR is, any number of things. We want to help you fund your work. So please, please, for all of our sakes, just make sure it's a solid product before you send it out the door. And that said, if you want to go to the next slide, I'm going to reboot again. I'd like to open the floor to any questions, and I thank you for your attention.
If you would like to please either call out your question or type it up in the chat box.
And if they type it in the chat box, if Lizette could please ask it, because I'm having to reboot again.
Okay, no problem.
No questions? I think that Glenn had some thoughts, if he's still with us, on some potential avenues for community-based participatory research that may be down the line for PBRNs. Are you there, Glenn?
I sure am, and thank you, Anna, for an excellent seminar on the nuances of grantsmanship in this area. You really offered some great insight and some very useful wisdom from experience and being involved in these kind of activities from a reviewer perspective. I'm sure that other folks on the call have got questions and are formulating them now. But while that's happening, yeah, we did think it might be useful to talk about what some of the kind of the current research funding opportunities are that are out there on the horizon right now that either explicitly call for a CBPR perspective, or at least funding mechanisms that are open to community-based, community-engaged research types of projects that are potentially relevant to the kind of work that public health PBRNs are doing in the area of PHSSR. And one funding mechanism or funder that is on the horizon that we've talked about over time. We talked about them a little bit actually at the last quarterly skill building webinar that we did back in April or late March, when we talked about network expansion and sustainability opportunities. And that's the new Patient-Centered Outcomes Research Institute, the CORI. One of the reasons why I mentioned them and why we have kind of been taking care to showcase them in the newsletter and otherwise is because this is the one element of the federal health research funding enterprise that is scheduled to grow in the amount of funding they have available over the next several years. As many of us know, because of the budget situation and because of the the economy and the stalemate in Congress, many of us are expecting that federal health research funding in many of the traditional federal health research funding agencies are likely to be stagnant or maybe even decline over the next couple of years because of those issues. But PCORI, the new Patient-Centered Outcomes Research Institute, is scheduled to actually grow in the amount of research funding that it's putting out on the street over the next several years. PCORI is a new entity. It was created by the Affordable Care Act. One of the reasons why it's scheduled to grow in its funding opportunities is how it actually captures revenue to put out on the street in terms of research funding. PCORI's research funding is generated through an assessment that is levied on health insurers and third-party administrators of health insurance, and it exists kind of outside the traditional congressional oversight in terms of the federal budget. It's generated kind of off the federal books to some extent, and so it's much more difficult for Congress to cut that funding. And so it's a fairly sure bet that the PCORI funding, which started out last year at about a couple of $1 million, is scheduled to grow over time to a steady state of upwards of $500 million per year in federal funding. So it's going to be a nice source of health-related research funding going forward. Now, as the PCORI name suggests, a lot of that funding is centered on kind of clinical research, research testing and comparing new drugs and devices, therapeutics, as opposed to research looking at public health and prevention. However, PCORI's, as their research has been, is established under law and through the Affordable Care Act, that PCORI's research priorities extend to public health and prevention kind of activity. Certainly, it's supposed to be doing research not only on therapeutics, but also on prevention strategies. And importantly, it's supposed to do research not only on kind of clinical services or individual services, but it's also supposed to be doing research on service delivery strategies and delivery systems. And so for that reason, we are pretty optimistic that the kind of research that public health PBRNs are doing, looking at prevention strategies, looking at delivery system strategies, those should be within the purview of PCORI. Now, why do we think PCORI funding might favor this kind of research approach that Anna's been talking about, community-engaged research, community-based participatory research? Well, part of that relates to the definition of patient-centered outcomes research that has been promulgated through the congressional authorizing legislation and now through PCORI and its committees. As the name, as the PCOR name suggests, patient-centered outcomes research, that notion implies that the research should be grounded in the priorities of stakeholders that are involved in delivering or consuming healthcare interventions and including prevention interventions. So PCOR is the field of PCOR research is supposed to be doing research that takes into account the values, the needs, the preferences of patients, of communities, of the healthcare providers and health delivery systems. And so to do that well, to understand what the needs of the patients are or what the needs of the communities are that you're studying, obviously these community engagement strategies can be very important mechanisms for doing that kind of research. So PCOR just earlier this year came out with its first major call for funding, call for proposals, and we featured those in the newsletters, and they're on the PBRN funding announcements the section of our webpage that lists funding announcements there if you're interested. But they articulated several focus areas for the current round of research funding. And those include, one of those 4 focus areas is an area focused on health disparities and looking at strategies for reducing health disparities. Again, Anna mentioned these approaches of community-based participatory research can be very powerful in terms of identifying compelling opportunities for reducing health disparities, for understanding the mechanisms that generate health disparities and helping to reduce them. So that the fact that the Core I has identified as one of its 4 priority areas, this area of disparities research, again, I think suggests that that these CVPR methods and approaches should be well received by this agency. The second area of priority that the PCORI identified in their current call for proposals is in dissemination and implementation research. And again, I think we've seen in other areas this growing field of dissemination and implementation research, how important it is for, again, understanding the stakeholders, understanding the values, needs, preferences of the stakeholders that are intimately involved in dissemination and implementation processes. So those stakeholders, again, include your target populations, the communities that can benefit from interventions. They include elements of the delivery system, public health decision makers, public health agencies, public health professionals, as well as policy stakeholders potentially that are involved in using research. So I think that second area of funding priority for CORI related to D&I research, I think, is also ripe for applying these kind of methods and approaches that Anna has been talking about. So that's one that's one opportunity that I would put on the table and encourage us to think about. I'll also mention, for those of you, if you look at the most recent PBRN newsletter that we just sent out to you earlier today, in that newsletter we also highlight the fact that the CORI, its Research Methodology Committee, just last week released their draft report identifying standards for methodology standards for doing patient-centered outcomes research and comparative effectiveness research. And so we'd encourage you to read through that draft methodology report, which again also addresses these issues and talks about the importance of community-based participatory research in the toolkit of research methods and approaches that are relevant for doing patient-centered outcomes research and comparative effectiveness research.
Thank you, Glenn.
Yeah, sure.
And we are trying to, as Glenn noted, we're trying to make sure that anytime we come across something that is a CVPR funding mechanism, that we are putting that in our newsletter. We're also trying to keep it on the website, as Glenn mentioned. So if you come across anything that you don't see in our newsletters, by all means send those to us, because we want to make sure that we're covering all the bases and everyone knows what opportunities are out there. We do have a couple of quick questions on deck. I know we're starting to run a little short on time. I think Lizette has forwarded to a couple of slides. I have some grant writing resources. That little video clip that we watched is part of a much larger NIH initiative. They have several things on their YouTube channel that are designed to help with grant writing. There are also some podcasts from DHHS, and on the next slide are, again, the starting points for participatory literature. This is by no means exhaustive, inclusive, anything along those lines. These are just places to start and look at their bibliographies, their reference lists, and make sure to mine those. I have two questions here, and we'll try to get to both of them. We'll start with Nancy Winterbauer, and she asked what my experience has been with practitioners participating as a community. And that relates to something I'm going to ask Nancy to talk about in a moment, but to date we have not, my work has not engaged practitioners as a community of practice, so to speak. We have involved practitioners as a stakeholder group in broader community-based research. So for example, when we were working with the people of a particular Superfund National Priority List community on what the future of that Superfund site, hazardous waste site, should be after the organization that operates there ceased operations, we engaged practitioners because we knew they would have a very particular perspective on what would be appropriate and inappropriate uses for that site in the future and what would cause concerns for their patients. So in that way, my own work has engaged practitioners as stakeholders within a larger community context. However, I know Nancy and I were talking last week about practitioners as a potential community of practice for doing community-based participatory research, and I think that might be an interesting approach to take, and it might yield some informative data about particularly practice-based research networks. Nancy, if you're on and able to take off mute for a moment and want to chat just a moment about that project, I'd love to hear about it.
Can you hear me, Anna?
Yeah, we can.
Okay, great. First, thanks for the presentation, and secondly, also thanks to you all for seeing these other opportunities like PCORI that that will take advantage of the network nature of the PBRN to do some of these sort of natural sort of intervention studies and so on. I think we really need to move in those directions to take full advantage of the networks that we're working in. But my question really had to do with a few years ago, and this was pre-PBRN. I remember when I was in Duval County, and of course I cannot remember the specifics, but we submitted a CBPR proposal. I can't remember the funder, but I want to say it was around diabetes somehow. And they did not recognize, and it was the practice community, so the community partners and so on in Duval, and who were acting as the community in the proposal, and the funders, and it was I think it was CDC, did not recognize the practitioners as a community, and I'm hoping that we are past that now. With it, and the PBRNs, contribute to moving us past that, but it's been kind of a question mark around these communities of practice, communities of identity, however you want to define that. But I think you're asking me to talk about the proposal or the project that we're going to work on.
Sure.
Is that right? So what we're thinking of, and this is Anna and Betty Beckmeyer and I, and Anna really contributed to the thought behind the design, so hopefully she'll comment on that. But we're thinking of trying to get participants from each of the PBRNs, or as many as want to participate, to kind of go through a thought process with us, looking at the principles of CBPR and seeing how they do or do not line up with, the way that we operate in the PBRN world, and maybe areas that need to be clarified, and how we can take fuller advantage of the participatory nature of the network. And did you want to talk about how you wanted to involve the sites in the design, Anna?
Sure, Nancy. And I think it kind of relates to what you were saying earlier. First, I think that the CBPR and reviews and the way funding agencies understand it has progressed over the years, and it's an evolving, well, it's an ever-moving target, let's be honest. They're really still trying to get their arms around it in many ways, but I'm hoping that we can have better success in the future by defining very explicitly communities of practice. We can borrow, communities of practice models from business, for example, and set up practitioners as a community unto itself, a community with a common goal, perhaps. But that's one way to do it. And my feeling was that if we're going to do a study on CBPR, then we should probably use CBPR methods to do it. And that would involve engaging the member networks in a discussion of what are the relevant research questions about PBRNs and CBPR and the linkages thereof. What approaches should we take to identify that? Should we conduct interviews among ourselves? Should we reach out into the broader practice community? Should we, there are a number of questions that really for the research to be truly engaged and truly CBPR, we need to be having these discussions on the front end. So I think that, I think Nancy and Betty and I are going to have a call in a couple of weeks, and maybe we can identify some ways to launch that, whether it's through, a few telephone interviews or maybe doing something at the annual meeting, or doing something in conjunction with another project. We still have to work through that somewhat, but that's something for folks to be thinking about. If we're going to talk about PBRNs as having the potential to capitalize on CBPR, I think Nancy's absolutely right that we need to be looking at what those linkages are And if we're going to do it, let's do it in a participatory framework from the get-go. So that was just my thought. But yeah, I know that it's been challenging in the past, CBPR funding, Nancy, because some review committees define it very narrowly and some define it very broadly. I think we're moving more and more to the more things fit in to CBPR paradigm. I hope that's the case, and we'll just have to keep pushing forward. But thank you for that, Nancy. And we have one more question, if Gulzar is still on and would like to throw it out. We've got about 5 minutes, and I'll try to be brief.
Okay, hi. So, great presentation, Anna. I just recently submitted an R21, and I was following a kind of guide or a book written by somebody about, you know, how to make NIH grants proposals like more attractive to the reviewers. And so one of the advice was, for example, that so typically specific aims, you just write specific aims, but according to that guide or the book, it said that you should basically make the summary in the beginning about your proposal in a way like that, you know, if reviewers just reviewed your specific aims section, they should be able to say what your proposal is about, like fully, like in terms of all those small aspects, things like significance and approach slightly covered. And so at the end of the proposal, I realized that there was a lot of repetition in things, and although it's supposed to be a very brief proposal. So I just wanted to get your opinion as a reviewer, as a kind of second opinion as to what do you say about this philosophy that if reviewers only got to review part of just the specific aims, or if they read the significance, they should be able to say, you know, a little more than just the significance.
Oh, thank you. Good question. Well, I'm going to tell you the dirty little secret of grant review committees. Because if you're getting 50 or 60 proposals to review, very often the only page of your proposal that the majority of the reviewers will have read is your specific aims. Okay. Your primary reviewer, as I said, will spend a whole lot of time laboring over your proposal. Your secondary reviewer as well, your tertiary reviewer as well, because they're on the spot. They have to know your proposal inside out. They have to be able to answer questions when other review committee members ask them. But review committee members, when the deadline is pressing up against them and they've got to go into that room, the specific aims may be the only piece of your proposal that they have spent any significant time with. So that's the real secret behind that chapter or that section of the book that you read, is the knowledge that sometimes the specific aims is the only section they'll have read. So yes, I would say encompass as much of your project as you can within that specific aims section. Sometimes it's useful if you have a diagram, because you can put a whole lot of information into one little diagram. It also helps to have diagrams and images. I mean, just from a purely formatting perspective, it always helps to have diagrams and images, pictures, particularly with community-based participatory. If you've got pictures of the investigators working together on something, that's always helpful. For a couple of reasons. One is it illustrates some of the points you're making. But two is when you're looking at 900 pages of proposals to read and every page is every single line filled up with text, it can be very daunting for the reviewer. They like to have that space broken up a little bit sometimes. But yeah, the specific aims is key, because if you have, say you have a review committee with 30 people on it, you have your primary, secondary, and tertiary who have read your proposal in depth, but you have 27 people on there who may or may not have read beyond the specific aims. You hope that they have, but they may not have. So yes, absolutely, pay special attention to that section, Gulzar.
Thank you very much. Very nice.
Thank you. I think we're out of time. Glenn, do you have anything to add, or shall we let everyone go?
Only thank you very much, Anna. This has been a fantastic session, and just a reminder that we did record this, so for posterity's sake, we know that you've got partners who may not have been able to make it, so the recording will be up on our website shortly.
Thanks for your time, everyone.
Thanks, Anna.
Right. Thank you.
So,